Hello, and thanks for stopping in. My name is Devaney Knight, and this is your mental health moment. Your mental health moment is a series of brief videos pertaining to the world of therapy and mental health related matters. We offer tips and insights for mental wellness, and when relevant, we offer resources when we have them. Please note, your mental health moment is not a substitute for professional therapy. If you feel that you might benefit from personal therapy, we strongly encourage you to seek out those services. Today, we're talking with Naomi Austin, who is a licensed professional counselor associate at Westlake Houston Counseling. Hey there, Naomi.
Hey, Devaney, how are you?
I am well today. Thank you. All right, why don't we start with you telling our viewers a little about yourself and the work that you do here?
So, I am an LPC associate. I specialize in working with children from ages 7 to young adults. Some of the most common issues that I treat in children is anxiety, depression, and low self-esteem.
Wonderful. Okay. Today we're talking about anxiety and we're talking specifically about anxiety in children. So maybe we can start with talking about, what is anxiety? What do those symptoms look like in children?
Yes, so I do want to start by saying that anxiety is common and it is definitely treatable. Anxiety is the body's reaction to perceived threats. In small doses, anxiety can actually be helpful. It can protect us from danger. However, when our anxiety starts to increase and it becomes severe, at that point, our anxiety can become problematic for us.
Mhm. Okay. And so children might notice having different feelings, right? Anxiety feels significantly different from not having anxiety. So, what might they notice in terms of how they feel? And what do you think parents might observe in their children's behavior that might be anxiety?
Yeah, so for children, I believe, right, all children are different. So they're going to experience anxiety in different ways. They're going to notice different things. However, some of the common ways that anxiety has been described are feelings of fear, stress, worry, um, nervousness, panic, even feeling on edge, feeling jittery, and even sometimes that feeling of butterflies in their stomach. And a parent, what they might notice in their child is that their children are asking more questions than usual about any changes that are coming up. They may have a more difficult time adjusting to changes. They might have their child complaining to them about stomach aches, headaches. It could be prior to like getting up to go to school or getting online for virtual school, maybe even attending events or social events. Their child might have increased worry or fear about everyday situations that might seem, to the parent as a normal situation. And their child might even be a little more jittery, a little more on edge than usual, and the parents might notice that.
Okay. And are there varying degrees of anxiety?
Yes, I would definitely say. I always say that there are three levels of anxiety. I would identify with a low level of anxiety, which is where anxiety is pretty rare for you. Moderate anxiety, which you might experience anxiety several times a week, but not necessarily on a daily basis. And then there's high anxiety. For the high anxiety, you might experience anxiety on a daily basis. And sometimes you could even experience it multiple times a day in various situations.
And in your opinion, do you feel that children's anxiety has increased with the COVID-19 pandemic?
Oh, I love this question.
Mm.
Yes, I do think that this question right now is so relevant for the time that we're in because I have definitely noticed, and there have been reports that children have had an increased level of anxiety with this pandemic. Not just children, though, teens and young adults. Have noticed this increase in anxiety since the pandemic began. The changes in the children's social life and their everyday normalcy is impacting them drastically. And that change is leading to higher anxiety in many cases. Some children that had not ever reported having anxiety have now begun to experience it and exhibit some symptoms of anxiety. The children that were reporting anxiety have noticed an increase in that level of anxiety. And because this pandemic is ongoing, the levels of anxiety have just been continuing to increase for many.
Mhm. Okay. And at what point would you say a parent should consider therapy or some sort of therapeutic support for their child?
Yeah, so I would recommend that a parent consider therapy if they're noticing that the anxiety is causing a disturbance in their child's everyday functioning. What that might look like to the parent is noticing that there's a change in their child's academic performance. Maybe their grades are dropping. They're having difficulty sleeping at night. Maybe they're having nightmares. They might be isolating more, but not want to attend any social events. They might just want to stay in their room. They might not want to talk to their friends. Um, at that point, I would definitely say if you're noticing any of those things, you might want to consider therapy for your child.
Okay. And what are some of the techniques that you use as a therapist in working with anxious children?
Yeah. So when I'm working with anxious children, I really enjoy utilizing art therapy. In addition, I like to work with a child to help them identify their triggers and help them identify and develop their coping skills to assist them in decreasing their anxiety. And it is really important for me that I collaborate with the parents so that I can help those parents feel as if they're equipped with the knowledge and with those tools that they need to help their children at home outside of the therapy session.
Wonderful, wonderful. Well, this is all such valuable information for parents out there that might, notice some changes in their children. And so, if someone wanted to, reach out to us and work with you, how do you deliver services? Is it like this? How does that work?
Yeah, it is. I offer flexible scheduling via telehealth. So I am available virtually, which I believe makes it a little bit easier for those parents to connect with me.
Wonderful, wonderful. Well, thank you so much for being here today. This was all very, very useful. Thank you so much for offering this information.
You're welcome. Thank you
All
so
right.
much. It's been a
Thank you.
pleasure.
All right. Bye bye.
Bye bye.